We're continuing to talk about the big news of the day, and that is the COVID-19 vaccine. After several long months of not knowing when the end is in sight, we do have a vaccine, and the shipments are happening right now all across the country. As we showed you earlier, healthcare workers are even taking the shot on live TV. Joining us now is someone who has been here since March. I love her a lot. Welcome, Dr. Payal Kohli. And Dr. Payal Kohli, we have a lot of questions, viewer questions about the vaccine. So I want to get started. First up, Kathy writes, if you've tested positive and recovered, do you need the vaccine?
Kathy, I would recommend the vaccine. So the CDC has not issued formal guidance on this, but as you know, there are some people that don't make antibodies even after they've had COVID-19. Some people make antibodies but then lose them as early as 2 to 3 months and can be at risk of reinfection. And we also don't know if the immunity to the vaccine actually lasts longer than natural immunity. So for those reasons, I would recommend getting it for sure.
All right, Doc, our next question comes from Larry. He says, does Dr. Kohli agree with the decision to give healthcare workers the vaccine first before the general population?
Oh, this is a good one, Larry. And I have to tell you, my friends and I have had a lot of heated arguments about this. So on one hand, obviously, we healthcare workers are at the highest risk of exposure, right? So yeah, maybe we should be first in line. But on the other hand, healthcare workers wear PPE all day long. They know how to protect themselves. So if the point of rolling out the vaccine is really to make a dent in all the American lives that are being lost every day, then shouldn't we actually be giving it to the community before we give it to the healthcare workers? Because that's how we're going to reduce hospitalizations. That's how we're going to reduce deaths. So I'm curious, what do you guys think? Do you think it was the right thing to give it to healthcare workers first?
1,000,000%.
Yes, I think that there should be some benefit for you putting your life on the line every day.
I thought your answer was fantastic. While you were saying, I'm like, oh, that's a great point.
Yeah.
Because I immediately thought healthcare workers first, but you kind of changed my mind a little bit about that.
Kohli, with the mind changing.
That's right. All right, Dr. Kohli, I like this question. It was sent in by O'Shea, which is actually Ice Cube's real name.
Is that right?
O'Shea Jackson,
Okay.
yes. Will the list of ingredients be made public? Will the makers of the vaccine be held liable for potential harm caused? Interesting.
Very interesting. So O'Shea, the list of ingredients is already public in the FDA briefing documents, and it has 4 simple things in it. You ready? The mRNA component, that's the active part, that genetic blueprint that we've talked about. Some fats to stabilize that mRNA component, some salts to maintain the pH of that, and then some sugar to protect it when it's being frozen to those ultra low temperatures. So there's no microchip that's monitoring you, there's no GPS tracking device, there's no actual virus, and all of those conspiracy theories really need to be laid to rest. And in terms of liability, that's a more interesting question because, you know, on one hand, this is a bit of an investigational product because it's been approved under emergency use. So I don't know what the company's liability would be because I'm not a lawyer, but obviously from a doctor's perspective, because it's still being studied, I think they'll be relatively protected even if something wrong comes out of the vaccine.
I like that everyone thinks there's a chip in there.
Yeah.
You carry your phone with you everywhere, you morons.
Okay.
And also, like, they never sued Dr. House for trying really, like, out-of-the-box, like, cures.
The TV fictional character?
Yes, he never got sued. He was like, give me a pencil and some
What a terrible argument also.
He never got sued.
Oh,
he always knew what to do.
He wasn't real.
He thought outside the box.
Thank you so much, Doctor, who is real. We'll be right back.